The South African Medical Association trade union Samatu is calling for an investigation into the tragic death of a medical intern at the Prince Mshiyeni Memorial Hospital out in uMlazi in Durban. Dr. Alulutho Mazwi, who passed away on Monday while reportedly on duty, had recently been diagnosed with diabetes, and allegations now suggest that he was actually instructed to continue working despite his being ill. And while the KZN Department of Health has expressed condolences, it has yet to address these claims. And to further unpack this, let's now welcome Dr. Mvuyisi Mzukwa from the South African Medical Association, and he's the chairperson there. Doctor, it's great to have you with us, although under these circumstances. So this tragic incident has sparked public debate once again about many issues, not just operationally at public entities, but within the health sector, but ethical conduct of managers and supervisors at these highly stressed entities. What has been your reaction to these news? Yes.
Good afternoon to you. I'm sorry about that.
Thank you, Doctor. Go ahead.
Yes. I would like, first of all, just to convey our sincere condolences to the family, the Mazwi family, the colleagues, the friends, and everybody else that was close to Dr. Mazwi, during this unimaginable, difficult time. Dr. Mazwi has been a colleague of ours in the profession at Prince Mshiyeni, very dedicated, but also, his death when, the healthcare system is coming under pressure in terms of shortages of staff, in terms of the conditions on the ground, where you find that there's shortages of medicines, shortages of equipment, where there's broken equipment and all these things, safety issues as well. But on top of that, there's a serious challenge of healthcare professionals who have been neglected by government in terms of taking care of these professionals. Since the times of the COVID-19, healthcare professionals have been living under pressure and they've been stressed. Some of them have taken their lives or committed what we call suicide. So those are the challenges that are facing us, and we feel sad about this.
But then, Doctor, I'm glad you actually pointed out those challenges, because that was going to be my follow-up, because we have long been hearing about these challenges being flagged by the medical fraternity there about, as you said, staff shortages, overworking, and what then do you need in order to address these challenges? And what has the department said in their engagements with the concerns that you have tabled to them as the medical fraternity?
I think this is a serious discussion that must happen between Treasury and the National Department of Health. We have always insisted that the money that comes out of Treasury to the provinces that relates to the recruitment of healthcare professionals must be ring-fenced. It must be conditional. It must be talked specifically to the employment of healthcare professionals. Because if you send that money to the provinces and you have not ring-fenced it, they can use it whatever way they feel they want to use it for. So this is what we're calling for to government. But on top of that, we're asking government, and we're insisting on government to implement a plan, to have a plan, human resource plan, that should be talking to the future of this country. How many doctors do we need in the system? How many specialists do we need? Because if we don't do that, sit down and plan, we are still going to be facing the problems that we're facing now. But the brunt of this whole thing is being faced by healthcare professionals. Healthcare professionals have been improvising, sometimes using cardboards to put babies in there and doing all sorts of things to try and cover up. But that time has passed, because now they cannot cope. They are under pressure. They are killed by major depression. So those are the issues that are facing the healthcare professionals as we speak.
And what are unions then doing to safeguard, the medical staff against these practices, Doctor? Is there anything that they're doing on their side?
We have had meetings with the Minister of Health, who've been telling us that the problem is that they don't have enough funds to employ healthcare workers. But the problem is, as you will know, the problem is that there is mismanagement of funds in the Department of Health. Until that they face that problem, they are not going to go anywhere. But on top of that, there is an issue of ethical leadership and governance. They are running for this high stuff like NHI and stuff like that, but they're leaving things that can be rectified now. Issues of attending to the dilapidating infrastructure, issues of employing doctors now, because you can't be talking the future when in trouble now as South African. We need the government to intervene now. Otherwise, this healthcare system, we are going to get to a point where we cannot reverse what has happened. The issues of HIV and AIDS, when the US aid was withdrawn from the country, we have not seen any progress in that regard.
Doctor, unfortunately, we're out of time. We're going to leave it there. Thank you so much for your input, and we do apologize for the poor connectivity there. That was Dr. Mvuyisi Mzukwa there from the South African Medical Association, and he is the chairperson there.